is our next patient, first visit. So it's a new case. We'll be doing to tell you. Ki Hindi, Bangla, English. English is good. Good. That's great. You don't have to translate. His age 32. Bolo. English में बोलो क्या क्या problem है? What are the issues?
Facing a problem in stomach from last 7 to 8 years.
Facing stomach problems for 7 to 8 years.
7 to 8 years. After I eat any type of food, it means a simple food like rice, dal and potato only food. Then I also face a gastric problem and lose motion.
Rice, potatoes, gastric issues, lose motion. Bolo.
Then I also suffer from not properly sleep. If I wake up at 5:30 for washroom, then I won't be able to sleep for then.
Sleep is improper. If he wakes up at around 5 o'clock, he is unable to sleep thereafter.
After that, I am also facing a hair loss, tremendous hair loss.
Hair loss since?
Since last 4 to 5 years.
Since 4 to 5 years.
And sir, and also suffering fever from inside. Not feeling temperature from outside very much, but feeling having fever, very much fever from inside. Then I eat belladonna 200 because medicine shop of Homeopathy suggested me to take belladonna 200.
Okay, he feels feverish. He takes belladonna 200.
And sir, I am also facing suffering from. मुझे थोड़ा सा कोई चीज़ याद नहीं रहता, बहुत जल्दी भूल जाता हूँ.
Forgetfulness. He forgets things very quickly.
And stammering problem also there.
Stammering.
Stammering लिखा नहीं है सर.
कब होता है stammering? When do you get the stammering? এর ওষুধ হবে না, আমি চিন্তা করে করব, বলো পোস্টে পাঠিয়ে দেবো, পেমেন্ট নিয়ে ছেড়ে দাও.
अभी जैसे सर बोल रहा हूँ तो बीच में थोड़ा सा टक रहा हूँ या फिर ऐसे बोलने से.
कब होता है ज़्यादा? When do you get the stammering more?
Sir, when I talk to someone like that in fluency and very much when I get tensed.
When you are anxious or tensed, he gets the stammering.
Yes, sir.
What else?
Yes, sir.
Gastric, what are the issues? Elaborate it.
Suddenly, the entire middle portion is being hard.
Middle portion of the abdomen gets tight or hard. Okay.
And after 2 to 3 hours, after eating any oily food or any spicy food, slight spicy food, I get loose motion. After every 2 to 3 hours continuously loose motion. And
after eating oily or spicy food, he gets loose motion.
And also, sir, if I eat any type of food, breakfast, lunch, dinner, I get sweating from this portion on face or head. Tremendous sweating, not in body.
Sweating from the head when?
And when I get to eat any breakfast, in time of breakfast, lunch, dinner.
So when you are eating, after eating, you get head sweats and face.
At time of eating.
During eating, you get sweating on the head and face.
Yes, sir. And always having low blood pressure.
Low blood pressure. Any particular problem you face because of low blood pressure?
No, sir. Each and every time I feel my pressure, if I check, it's continuing in a low position.
So you feel any like dizziness, weakness?
Weakness, yes, sir. Always feeling weakness.
Sorry?
Always feel weakness from this low blood pressure.
Always feel weakness.
Yes.
What else?
Sorry, sir.
What else?
That's all problem I am facing, and also some my inner problem from my childhood, from 1 year, from 1 month. Allopathy doctor, TB medicine continued for 9 months.
Why?
Without knowing my parents. My parents don't know about that. But
he had tuberculosis medication for 9 months. When?
From 1 month, when I was born.
Oh, 1 month of age.
Yes, from 1 month of age to 10 months, doctor.
The TB was not there.
No, sir, TB was not there, but he was intensely forcing me to take TB. My mother get to know from medicine shop that I am negative. And that time my mother goes to doctor. He torn all the reports of to test and thrown away. But go and what you want to do, go.
He was given anti-tubercular medication from age 1 month to 9 months without the knowledge of the parents. Anything else? Gastric symptoms, how it started?
From past 7 to 8 years.
Any reason why it started?
Sir, previously I eat very much. Basically, I eat very much oily food, means aloo chop and chana churmuri. That was
Lot of oily food intake in the past that could have been the triggering factor. Appetite, bhook. Appetite is low.
But when I feel hungry, I suddenly start feeling shivering because of hungriness. So I can't control now hungriness.
So when he is hungry, he gets shivering. He cannot control hunger. Bowels regularly. What is the nature of
Yes,
the
sir,
stool?
bowels, sir, stool is not regularly, but when I eat slightly of spicy food, I get started loose motion and vomiting, bowelness.
Vomiting also.
Yes, sir.
So when he has spicy food and oily food, loose motion as well as vomiting. What kind of vomiting?
Sir, peeth बाहर निकलता है जब भी vomiting होता है तो.
Khatta.
Yes, sir.
Sour vomiting. Kadwa na khatta?
खट्टा पूरा वो.
More sour. I'm asking is more sour or bitter? He's saying more sour. गैस होता है, डकार होना, हवा छूटना.
डकार नहीं, हवा छूटता है, लेकिन यहाँ बहुत ज़्यादा गैस होता है. कुछ भी खा लो सर गैस होता है.
More flatulence. I'm asking is there more burping or flatulence? More flatulence. ऐसा कुछ खाने से जो गैस ज़्यादा होता है? Any particular food which causes bloating?
कोई भी खाना खाने से भी हो रहा है सर. रोटी सब्जी दाल कुछ भी प्लेन खाना खाने से भी गैस हो जा रहा है. ऐसे नहीं.
No particular food triggers the bloating.
अगर थोड़ा सा ऑयली खा लेता तो फिर बहुत बढ़िया.
Oily is, he's repeating it again, oily food again aggravates it.
ऑयली एंड स्पाइसी.
चक्कर देता है?
हाँ सर, चक्कर में बहुत बार गिर चुका हूँ इसीलिए पहले.
He has frequent episodes of blackout and vertigo. He has fainted, एकदम faint हो गए थे.
बहुत बार पहले.
Fainted quite a few times. दांत में क्या हुआ?
दांत में सर 5 to 6 दांत निकलवा चुका हूँ. इसे एक्सट्रैक्ट करवा चुका हूँ और 2 बार आरसीटी हो चुका है.
Cavities quite a lot. 5 teeth was extracted. 2 root canal procedures have been done.
और डॉक्टर से पूछा तो बोला था कि वो पेट की वजह से ही हो रहा है गैस.
And doctors had told him it was because of his gastric issues. Sensitive teeth, sensitive है
यस सर.
from cold water.
यस सर, कोल्ड वाटर से बहुत.
Which side?
अपर साइड है.
Right.
यस सर, राइट अपर.
More right-sided sensitiveness of the teeth was from cold water. Cough,
कफ सर तो थोड़ा सा वेदर चेंज होता है तो कफ लगा रहता है.
weather change, he gets a cold. What symptoms? क्या होता है?
फिर खांसी आने लगेगा, बुखार पकड़ लेगा, सर्दी खांसी बहुत बढ़ जाएगा.
Cough and fever. खांसी, सूखा खांसी ना बलगम रहता है.
खांसी रहता है पूरा. सर एलर्जी मेरे को बहुत ज़्यादा है.
Dry cough, कैसा एलर्जी?
इयोसिनोफिलिस मेरा बहुत बढ़िया आता है.
Eosinophil is generally high.
बहुत बढ़िया था. जब भी मुझे आता है जैसे कि थोड़ा सा धूल लग गया या कुछ भी ऐसे वेदर चेंज हुआ, बहुत ज़्यादा खांसी होने लगी.
Dust or change of weather, he gets a cough. सांस का तकलीफ होता है?
सांस का तकलीफ तो इससे जब खांसी आता है तब बहुत होता है, नहीं तो ऐसे नहीं.
Cough can cause sometimes mild breathlessness. सर्दी होता है?
सर्दी नहीं सर, सर्दी उतना नहीं है. सर्दी जब होता है तो जो वेदर चेंज होता है तो सर्दी स्टार्ट हो जाता है, वाटर रनिंग स्टार्ट हो जाता है. रनिंग
Change of weather, runny nose can happen.
और सर स्टैमरिंग प्रॉब्लम देयर इज वेरी मच. आई एम फेसिंग स्टैमरिंग प्रॉब्लम फ्रॉम लास्ट पास्ट टू 1 year to 2 years.
Stammering is more for last 1 to 2 years.
And from past 2 years I don't have any job, so I am very much depressed from past 2 years.
Past 2 years, no job, depressed. क्या पढ़े हो?
Accounts.
You studied accounts without any job now. Got the symptoms up till now, age 32. I'm just repeating this. Major concern is gastric, epigastric tightness or hardness, worse from rice, potatoes. Spicy and oily food causes loose stool and vomiting, sour vomiting mostly, low appetite, cannot tolerate hunger, can cause shivering. He's been there since last 7 to 8 years. Hair fall is quite a lot, low blood pressure with weakness, episodes of vertigo with blackout and fainting. Past history of tubercular medication after birth. Sleep is poor. If it breaks, it's difficult to sleep again. Jobless, hence depressed. Lot of cavities with sensitive teeth, more on the right side, worse from cold water. Dry cough with fever, worse in change of weather, worse from dust. An allergic tendency with high eosinophil levels.
Sir, an astrologer has suggested me to do the ear piercing of both ears. Can I do?
देखिए बोल दे रहा हूँ. हेयर फॉल कब से है?
हेयर फॉल तो सर बहुत दिन से.
कोई कारण जिससे शुरू हुआ?
सर नहीं पता कोई कारण तो ऐसा.
Hair fall, any etiology? None as such. rice and potatoes, that makes his problems worse.
Each and every simple food when I eat, I get a problem of boilness start suddenly. After
It aggravates.
any simple food.
What do you eat?
Chapati, fried potato, dal, rice.
These things also aggravate.
Yes, sir,
He's saying even the simplest diet can, like home cooked food can also flare it up.
I have the allergic.
7 years age it started. Anything you feel which could have triggered, you said you took a lot of fried food, but any other, in lot of medications you took that time, or any emotional issues that time which could have triggered? उस टाइम पे कोई मानसिक दबाव था, कुछ दवाई चला था, ऐसा कुछ चीज़ है जिससे ये प्रॉब्लम का शुरुआत हुआ?
नहीं सर, ऐसा कुछ नहीं था।
सिर्फ वो स्पाइस
ऑयल फूड की वजह से ये सर।
says it's mostly due to oily food. उल्टी होता है?
हाँ सर।
कैसा?
सर जैसे कि पित्त नहीं निकलता है, वैसे निकलता है, पूरा
पानी जैसा निकलता है।
Vomiting is greenish, हरा हरा.
पानी पूरा निकलने लगता है।
तो गले में उंगली डाल के करना पड़ता है ना, ऐसे ही होता है?
फोर्स करना पड़ता है, जब बहुत जैसे गैस पूरा लगता है कि
I'm asking if you have to induce vomiting or it comes out on its own, huh?
Sir, it comes out on its own, but I have to, if I do vomiting, I feel very much controlled and relaxed after vomiting.
Feels better after vomiting. ठंड ज़्यादा लगता है ना गर्मी ज़्यादा लगता है? You like cold weather or warm weather?
Warm weather.
You like warm weather.
Yes.
You don't like cold.
No, sir.
You need lot of clothes in cold weather.
Yes, sir.
Chili. खाने में what food flavors you like? Sweet, sour, salty,
Sir,
spicy, fatty, oily.
Salty, I like more salty food and then sweet food.
Salty is number one.
Salt is, yes, sir, salt is number one, and spicy is not I like, sir, because I don't feel my guts is not supporting spicy food.
But
So I
say you don't have any problems. Your gut is absolutely fine.
Then I can eat spicy food.
Then what is number one? Sweet, spicy, salty, fatty,
Salty,
oily,
then
bitter.
Also salty and spicy. If my gut is alright, then salty and spicy I can take.
Always make sure you ask the patient's desire, not his diet. His system is unable to support spicy, but he likes it. Salty and spicy. Extra salt?
Yes, sir, I take extra salt and on every food.
Thirst, water
Yes,
intake?
Yes, sir, water intake there
Is okay.
Yes, sir, is it.
Thirst is average. Temper?
Temper is very much high.
High.
Yes, sir.
Like, elaborate?
I
You
get
get-
angry even in a sudden, if I want to, if I'm explaining someone, if he doesn't understand, then I get tempered.
What do you do when you are angry?
I shout on him.
Anger, shouts, patience,
Patience is very less.
less.
Very less.
Impatient, any fear?
Fear from dog and water.
Dogs and water. Anxiety?
Yes, sir, there is anxiety.
What do you do when you are anxious?
I try to listen music, reading books.
Listening to music makes anxiety better.
Yes, means controlling anxiety.
What problems you face when you are anxious?
Sir, my body gets start shivering and my heartbeat also gets start moving fast.
Palpitation and shivering when he is anxious.
Sir, an allopathy doctor has suggested me, told me that after when I visited last in Coimbatore, told that you have IBS problem and it won't be curable.
Show me the last endoscopy report.
Yes, sir.
जो टीबी का मेडिसिन दिया था उससे कुछ प्रॉब्लम हुआ था?
इसका शरीर कभी नहीं बढ़ा सर, माने healthy
I'm asking any problems happened due to the antitubercular medication. Mom says that his health didn't improve at all.
अब नहीं पता कि उसी के जरिए ऐसा हुआ क्या।
Not sure was it due to that or something else.
43
He has a squint on the left eye. बायां आँख थोड़ा
Yes, sir,
squint है.
squint है, हाँ. तो उसका सर्जरी बोल रहा है डॉक्टर करने के लिए, आई डॉक्टर.
ये अपने आप हो गया सर, पहले बचपन में था ही नहीं।
Squint was not there in childhood. Just came back. Endoscopy का report कहाँ पे है? Have a look. Anything?
सर endoscopy.
Endoscopy report shows reflux gastritis.
सर आई हैव
सर दर्द, चक्कर, ये सब कुछ
सर चक्कर तो
बोल दे.
से रहता है, जब भी प्रेशर लो रहता है तो सर दिस इज आल्सो रिपोर्ट आई हैव टेस्टेड डॉक्टर हैज.
ये इस बार किए थे।
उनको दो डॉक्टर, उनको दो. मुंह से लार गिरता है.
हाँ
सोने के टाइम
सलाइवेशन ड्यूरिंग स्लीप, मुंह में छाले होता है.
हाँ छाले होते हैं बहुत सारे बहुत.
वेरी फ्रीक्वेंट माउथ अल्सर्स, जीभ दिखाओ. Tongue is nothing very specific, to be honest. घुटना में दर्द होता है.
घुटना में सर आई फॉलन डाउन once my this knee has been removed like this when I was walking and I fall down and there is a ligament strain doctor told.
Ligament?
Strain.
Ligament strain.
Yes sir.
How you got injured?
I have suddenly walking on the street and suddenly I felt like my knee has been twisted and I felt like in sitting position.
Like a sprain.
Yes sir, like a sprain.
And you had pain here?
Now sir, pain is very not so much higher because now doctor has given me the exercise bed.
So not so much pain.
No sir, not so much pain.
Right knee sprain happened. Sometimes he gets pain on ascending the stairs.
Yes sir, on ascending the stairs and when I sit on the floor, when I get up. then
Getting up from the right sitting position. That's it. क्या होम्योपैथी खाए हो दिखाओ. Any questions anyone has? It's a new case, right? We're seeing him for the first time.
You have an eye squint and operated.
Yes, yes, on left eye I have eye squint. So doctor has suggested me a surgery.
But you did not get.
But I didn't get surgery. But yes, told me to do a brain MRI. But still not I have done.
Natrum for 6x Cinchona mother. These were the remedies prescribed.
किस तरह बुलाया है
I am also taking sir this one also for 2 to 3 months. Then doctor stopped suddenly.
Abies nigra tincture.
So why did they give him the medication at a month old? Was he ill?
एक महीना में क्यों टीबी का मेडिसिन दिया था?
Sir 9 months दिया था वो total.
हाँ, क्यों दिया
जैसे
था?
हम पोलियो का इंजेक्शन लगवाने गए थे, प्राइवेट डॉक्टर थे पीजी खंडरवाल से, तो वो उसका मन को टेस्ट आउट किए तब हमको उसके बारे में कुछ भी पता नहीं था. तो टेस्ट आउट करके दवा देने लगे, हम खिलाने लगे. तो जब 8 महीना निकल गया तो हल्दार फार्मेसी बोला कि किशोर बोधी वो छेड़े भालो আছে আমরা কেন এটা জানো না কেন না তো ওদের টিবির ওষুধ দিচ্ছে গিয়ে डॉक्टर को गए बोले जब मंटो टेस्ट सब फाड़ के फेंक दिए, बोले कि जाओ मेरा क्या कर लोगे हमको नहीं पता. उसके बाद से शरीर में इसके एक भी शरीर बढ़ता नहीं है सर. थोड़ा सा
Mom says that I didn't know why the antitubercular medicine was prescribed. They confronted the doctor and it resulted in altercation.
But no presenting symptom like a
No,
collapse,
no,
nothing.
nothing. Bad effects of anti-tubercular medication. We have a very useful remedy, streptomycin. Bad effects of anti-tubercular medication. We have a very interesting remedy, streptomycin.
Sir,
फैमिली में टीबी था किसी को?
no sir, no.
कैंसर?
Cancer no. Diabetes. My grandfather has
मेरे
diabetes.
ससुर को
Family history of diabetes. Streptomycin is a useful remedy for bad effects of anti-tubercular medication.
सर होम्योपैथिक डॉक्टर को दिखाए थे ना तो सर वो नहीं डायबिटीज है सर 2 साल दिखाए थे सर काम नहीं.
Streptomycin. I don't think it's there in Borrelia or Allen's, but it covers for bad effects of anti-tubercular medication. अच्छा ठीक. Lots of homeopathic medicines in the past, Lycopodium, Rustox, Merck Core, Natrum Sulf, arsenic, or a Metallicum pulsatilla.
Sir, can I continue this medicine? I have 6 dose left. This is allopathy medicine.
Vitamin D, yes,
Can I
yes.
control?
Yes,
Sir, I have eosinophils very much high.
हाँ देखा मैंने. ठीक है मैं दे रहा हूँ.
सर पियर्सिंग करा सकते कि नहीं
हाँ कर सकते हैं. In a case which has had lots of medications in the past with anti-tubercular medication, in a patient who is better by vomiting, in a chilly, irritable, impatient constitution, we'll start with Naxomica 30 followed by 200. I repeat again the points. Chilly, irritable, impatient, desire for spicy, with better by vomiting, and it's a bilious vomiting because it's greenish, so bilious vomiting. Bad effects of medication, could be the anti-tubercular medication bad effects. And also I would like to share, Naxomica is also a fabulous medicine for bad effects of sprain. If you open Rostock's chapter, Allen's please, Allen's Rostock's chapter. In bracket. Have a look in Rostock's please, Allen's.
Sir, I have also sir बोलने का बीमारी बहुत ज़्यादा बोल दिया.
बोलते हो ज़्यादा.
हाँ भूल जाते कोई भी चीज़.
भूलने का, हाँ बोले वो, मैं दे रहा हूँ.
ठीक है सर. सर आईवीएस ठीक कर दीजिए सर.
कर दूँगा. Rostock's, Allen's, although the sprain is not the decisive factor here, but I just like to share that with you. If you are there in Rostock's, Allen's, where is it? Second paragraph, ailments from spraining or straining a single part, muscle or tendon, in bracket Calcadia and Naxomica. Naxomica is also a remedy which has bad effects of sprain and strain. So do remember it in cases where perhaps Rostock's didn't help. Everyone got that? Allen's, Rostock's chapter, second paragraph. Ailments from spraining or straining a single part, muscle or tendon, in bracket Calcadia group, Naxomica. Obviously that's not the decisive factor here, but Naxomica will also address that as well. I repeat the points again. A patient with predominantly gastric issues with bilious vomiting, where the patient is better by vomiting. How the complaint started? Lot of excessive spicy and oily food in the past. What is in the background? Lot of abuse of anti-tubercular medicines in the past. लिखा है, मैंने देखा है. In a chilly patient who is irritable, who is impatient, who also likes spicy food. Naxomica 30 followed by 200, as we are trying to cover the etiological factor. There are two etiological factors here. One is the bad effects of anti-tubercular medicine in the past, and the second etiological factor is so much of oily and spicy food he has taken, which could have triggered the onset of his gastric issues. And Naxomica will also address that.
फीवर भी था से बहुत रहता है. फीवर हर 15 डेज बाद फीवर आ जाता है. भीतर से फीवर
So chilly, irritable, impatient. The etiology, which could be bad effects of ATD, anti-tubercular drug, or it could be the spicy food intake. With a history of sprain in the past and bilious vomiting. Remember, Naxomica is a bilious remedy. So the bilious vomiting which is greenish, Naxomica will address that hopefully. And the desire for spicy as well. अभी एलोपैथिक दवाई लेते हो कुछ?
एलोपैथी अभी सर नहीं, अभी तो बंद कर दिया. होम्योपैथिक खा रहा हूँ. सिंचोना ऑफिशियल
वो जो दिखाए.
हाँ सर वही खा रहा हूँ. अभी एलोपैथी बंद कर दिया हूँ. 1 महीने से बंद है. बेलेडोना 200
कुछ मत लेना अभी ये सब.
सर बेलेडोना 200 बुखार लगता है.
नहीं,
ठीक है सर.
मैं दे रहा हूँ.
ठीक है सर. बुखार का भी
बुखार आने से क्या होता है?
बुखार सर भीतर में टेम्परेचर नहीं रहेगा, लेकिन भीतर में बहुत बुखार लगेगा. वीकनेस बहुत लगेगा, कमर दर्द, बॉडी में बहुत पेन होगा.
I'm asking he takes the belladonna, you understand, for the fever. I am asking not to take it. What symptoms you have with the fever?
Sir,
Weakness,
weakness and
backache.
body ache, headache.
Understood.
The temperature is not from outside, but I feel inner much fever very much.
I want you to open Boricae. In the relationship of Cyanothus, have a look please, Tinospora cordifolia. Tinospora cordifolia. If you haven't used this medicine, you are missing out on a fantastic remedy. Cases of fever with lots of weakness. Tinospora, Tinospora cordifolia, relationship of Cyanothus in Boric. Tinospora. It's mentioned a Hindu remedy for cases. Can you read that line, anyone? Hindu remedy for cases of fever with splenic enlargement, something like that.
Hindu medicine for chronic cases of fever with enlarged spleen.
There are 3 uses of this fantastic remedy. If you got it, Tinospora. A, cases of weakness, just weakness. Patient cannot get up from the bed. Many authors call it a pick-me-up remedy. Pick me up, pick me up from the bed. So, pick-me-up remedy. So, A, just cases of exhaustion, you are not getting any clear picture of anything else, give Tinospora as an organopathic. B, cases of fever with weakness, like what he says. Fever comes recurrently, along with that there is weakness. Tinospora can address both, can address the fever, can help with the debility as well. And thirdly, cases of malaria, cases of thalassemia which we get in the Indian subcontinent. Malaria, thalassemia, where there is splenic enlargement. So, hematological disorders, if you don't know the name of the disease, any blood related issues where spleen is enlarged, patient is very weak and he is getting fever recurrently, Tinospora is also a wonderful medicine in that case. Try using it, you won't be disappointed. It has helped in lots of cases. Lower potencies, tincture or 6C. बुखार के लिए एक अलग दवाई लिख दे रहा हूँ. I am asking him to take Tinospora in tincture whenever he feels very feverish. Do not take belladonna, try taking Tinospora in tincture. Cases of weakness, put that note please, pick me up remedy. A, cases of fever plus weakness, and C, cases of hematological disorder plus fever plus weakness plus splenic enlargement. One thing which is against Naxomica in the case, anyone? Against Naxomica in the case? He's chilly. So, open Naxomica please, Borik. Taco next, Shankar. If no. Stomach section, second last line. Loves fat and tolerates them well. Naxomica is a remedy which is generally can tolerate fat. Right? You see in bracket pulse opposite. So, that's the only thing which was against Naxomica in the case. He said oily and spicy can trigger my diarrhea. But Naxomica generally, तुम यहाँ पे बैठो, आप पीछे खड़े, आप यहाँ पे आ जाइए. Naxomica is a remedy which generally can tolerate fat, but that was the only thing which was against it. So, remember, oily, fatty food, Naxomica loves it, can digest it. That's again reverse of pulsatilla. Put Tinospora please in your notes for weakness, for fever, for there is anemia as well, because it's a splenic enlargement is there, anemia can also be there for Tinospora.
Could you give it in pregnancy?
Yes, you can use 30-200 C as well sometimes. I think it's called what, Giloy, the another name is? Giloy, Giloy, that's another name of Tinospora as well.